Well, we are here at New Vision Eye Center, and I'm here with one of the outstanding physicians at New Vision. And I can tell you that Dr. Stephen Tate has a lot to tell you about the specialties that he works with. It's wonderful to see you.
Thanks, Marcia.
Now,
nice to see you.
Dr. Tate, I know that as a physician here at New Vision, there are so many different types of conditions with eyes. What would you say is your specialty, and how do you treat with the new innovative ideas that are going on?
Well, I have two main specialties, cataract surgery and glaucoma treatment. And like you mentioned, we do have a lot of amazing new technology coming out with ophthalmology. Even year by year, we have a lot of new technology. And one of the nice things that we're able to do now is often blend and combine the treatments for some of those conditions, like cataract and glaucoma, for example.
So glaucoma, now tell me a little bit about, I know we don't need a medical, course, but glaucoma, cataracts, is there a correlation at all?
Well, not directly usually. Cataract is a clouding of the lens inside your eye. Right behind the iris, which is the colored part of your eye, there's a lens inside. Once light comes into your eye, passes through the lens, and then it strikes the retina in the back of the eye. The information from your vision is then taken back to your brain by the optic nerve. If the optic nerve becomes damaged, often, but not always by high pressure, we call that glaucoma. So cataract is a cloudy lens, and glaucoma is a particular pattern of optic nerve damage.
So the patient can determine the different disease that he might have?
You can't. The symptoms can be very similar, and getting an eye exam is really the
key.
The only way to tell.
So frequently, all of you doctors here at New Vision have certainly told us the importance of having that regular eye exam. Even if you're feeling great and you think you're seeing great, it's always something exciting that you can do or learn or find out to really see the world in a much clearer way. So if you were to say then, Dr. Stephen Tate here at New Vision, what exactly is your specialty?
Cataract surgery, glaucoma treatment.
All right, and there are some new treatments.
There are. One of the things that we've really been excited about has been a new treatment for glaucoma that we can do at the time of cataract surgery. It involves a very small micro stent called the eye stent. In the past, surgical procedures for glaucoma have been procedures that have had notoriously high complication rates. And for that reason, surgical intervention for glaucoma has historically been really reserved until people really have quite advanced disease. With the eye stent, it's a very safe procedure, does not add to complication rate, and has quite good efficacy. The downside, it is not as powerful as some of the older procedures, but the good side is it is very safe.
Is there a certain time, and I'm thinking about so often, if you don't catch it in time, there's a problem. What about when you have these eye conditions? How important is it to get it at the moment it starts?
Well, cataract is when we treat cataract, that's an elective procedure almost all the time. Cataract doesn't need to be treated unless someone is having symptoms or wants it treated or feels that they want their vision better. Glaucoma, on the other hand, is something that is quite important to have treated early on. The big problem with glaucoma is once a person begins having symptoms, it's almost too late to backtrack. Once a person has symptoms, that's usually when they've really had quite a lot of damage to their optic nerve, and we just can't undo it. So the key with glaucoma is to really identify it early, begin treatment early, and stabilize the disease process early.
And I would imagine that comes from those regular eye examinations.
It does.
When we talk about age, is glaucoma an age factor?
It is. The older a patient population is, the more prevalent glaucoma will be in that patient population. Same thing with cataract. Pretty much everyone gets cataract at some point in their life, given a long enough lifespan. Glaucoma is not that way. Certainly not everybody gets glaucoma, but people with genetic tendencies, people who have glaucoma running in their family, are at higher risk.
All right, so this is what I think we should learn is, as you say, know your mom and dad and find out exactly what is in your gene system too to find out, but always have those regular eye appointments. Very quickly though, before we have to wrap this up, Dr. Stephen Tate, what would be the first symptom then for glaucoma when someone says, I need to get to the doctors?
Well, one of the most worrisome things about glaucoma is there often aren't any symptoms.
Oh.
And again, it's not until very late in the game and until it's often too late to improve the symptoms that you would actually have any with glaucoma. You have to have really significant and severe damage to the optic nerve often before someone would notice any change in their vision.
Oh boy, that just shows you that regular eye condition is and having an eye appointment every single year, and maybe even 6 months. When is the first time you should have an eye? When you're born, right?
Well, most people have had an eye exam at some point in their life. For most people, once they get over 40, it starts becoming a good idea to have an annual eye exam.
It's amazing what happens when you turn 40. Absolutely. Dr. Stephen Tate, thanks so very much for talking to us about what you do here at New Vision, making all of us see the world a little clearer. Thanks so much.